the next session, which will set the scene to discuss the interplay between informal employment. So we will really shift the focus towards informal employment, the absence of social protection, and health and well-being. So I'd like to call to the podium our next speakers, who are Frédéric Lapeyre, who is the ILO Priority Action and Formalization Director. So who will chair this next session. And then we have a sequence of speakers. I would like to also welcome Dr. Jukka Takala. And then we have our colleague, Christina Berendt from the ILO. And we have some speakers who will be connecting also remotely. So, Frédéric, we will be together for about an hour. Now, I should remind our online audience that there is a dedicated Q&A chat, and you are welcome to post your questions in whatever language, well, between English, French, and Spanish, you would like to use. And we will make an effort during the day to reply to your questions in written form. And then, of course, in some sessions, we will also have time for Q&A. So we will try to pick out any questions that you post online. So if you're just joining us, I would also like to remind you that we do have interpretation in French and in Spanish and English. So if you are online, there is an interpretation icon at the bottom of your screen, and you can click on it and pick your preferred language. Without further ado, I will hand over to Frédéric, who will set the scene, and then we will have a short video presentation by one of our speakers, and who will frame the session as well, and from a worker's point of view. And then we will have 3 presentations of 10 minutes each, and then we will have a segment of Q&As, so questions and answers. Over to you, Frédéric.
Thank you very much, Constanza. Good morning to all of you here participating in the room to this conference, and to those online, the speakers here or online. So I'm Frédéric Lapeyre. I'm the director of the Priority Action Program on Transition to Formality. It's one of the 4 Priority Action Programs recently established by the ILO and by the DG to address 4 critical cross-cutting policy challenges for realizing the decent work agenda, and calling for integrated strategies and coordination. And so I'm very pleased to chair the first session of the conference, which brings together here or online 4 very knowledgeable speakers who will help us to better understand the interplay between informal employment, social protection, health, and well-being. So we are late and we have only 1 hour, so I will be also the timekeeper, I'm afraid, and we have a coffee break waiting for us. So I will try not to be late, thanks to all of you. What is the reality of the world of work we are addressing when focusing on informal employment? I think that's a very important issue to address. So we need first a definition. We have a kind of broad definition, which is, informal economy. It's all economic activities by workers and economic units, which are in practice or by law not covered by formal arrangement. And based on that, we have also statistical definition through recently revised through the ICLS 2023, providing the criteria for definition of informal economy, informal employment. And what is very important with those definitions is the complexity of the issue of informal employment and tackling the challenge of transition to formality. Because, when we are talking about informal employment, we are talking about workers in informal sector economic units, self-employed, wage employees in micro and small enterprises, which are not registered. But we are talking also about workers who informal sector enterprises, but who are not declared or under-declared. And we are speaking also about domestic workers in households who are not declared. So it means that we need different policies for different groups and different kind of informal employment. And we need also to focus on numbers. As you said, it's 2 billion people, workers, in situation of informal in the world. It's almost 60% of workers. It's up to 90% in low-income countries. And it's also 90% of micro and small enterprises, which are in a situation of being in the informal economy. The last 10 years, we have done a lot in terms of categorizing and having a better definition or view about who are those in the informal economy through diagnostics, through statistics. And we know it's linked to low productivity and low earnings economic units. It's linked to the lack of social protection coverage. It's linked to the low level of education and skills. You have a sectoral component, which is very strong, linked to agriculture, to workers in rural areas, to some categories of workers like domestic workers, some categories of workers like women, young people. And it's linked also to the lack of opportunity and mobility, even intergenerational inequalities, because when you are born in a family in the informal economy, in low-income countries, you have also very few opportunity to escape the future in terms of accessing the formal or informal employment. And why it is a priority challenge to tackle transition to formality? Because we could say also people are securing their livelihood in the informal economy. But what we know, and I think the COVID-19 was an eye-opener about that, is the fact that informal employment is one of the structural barriers to the realization of decent work agenda and to the SDGs, the realization of the SDGs, and also to the creation of productive employment through sustainable enterprises. So at the heart of and informal employment, informal economy is really at the heart of legal and implementation gaps for realizing fundamental principles and rights at work, including now OSH, occupational health and safety, which is part of them. So the issue is how we address those the remaining and the new challenges. And we have remaining challenges linked to trust of the people in the informal employment and informal economy to move out from informality, the issue of capacities of those people, economic units to move out from informality because of low earnings, low productivity, the issue also of weak enforcement mechanism or inappropriate compliance mechanism, and the issue of lack of fiscal space. But we have also new challenges linked to climate and environmental change and how we provide or secure the world of work, for example, linked to heat waves and protect the health of workers. We have also the issue of how we operationalize the Convention 190 about violence and harassment in the world of work, but also for OSH. We have recommendation 204 addressing, it's really a landmark recommendation addressing the issue of transition to formality. On OSH issue, you know, it's all about transition to formality, but when the life of the health of workers is in danger, the recommendation 204 is very explicit. It says immediate action. But how we do immediate action in the informal economy and through what tools, that's something very important. And so that's why it's very important to put emphasize on the recommendation 204 because it provides the policy guidelines and the guiding principle to tackle this issue of informal employment, informal economy. And it gives also some very interesting and important guidelines on the role of social protection and OSH in this as a key component of an integrated strategy for transition to formality. And if you look at recommendation 204, you know, when you have to tackle informal employment, you have to do three things. And depending on the level of economic development, it will be you have to balance the three things, but you have to facilitate transition from informal to formal to all those economic units or workers who are in situation of informal employment or who belong to the informal economy. You have to create productive employment in the formal economy, especially for all the new entrants and the young people. And you have also to prevent informalization of formal jobs. And that's also a key issue. So the extension of social protection is a core element of any strategy for transition to formality, because it's a key incentive and if you speak and if you do surveys with those in the informal economy, they are not all poor, but they are always vulnerable in the informal economy, especially to health issues. So if you look at their demands, health and social protection is a key one. And that's why it's a key incentive for them to move out from informality. Then it's a key component also for an enabling productivity ecosystem. We need structural transformation, we need fiscal space, we need inclusive growth. And for that, social protection and improving health is really one important component of a productivity ecosystem. And it's also social protection, a key pillar for social justice and social cohesion. So that's why it's so important to map and analyze good practices and innovative approaches of social protection, of extension of social protection to those in the informal economy, and to see also how we can provide quality services, leaving no one behind. And the digitalization is a very important opportunity. It is opening very interesting opportunities, social and solidarity economy also. And that's why it's important in this session one to explore all those issues. First, the need expressed by workers in the informal economy for adequate occupational health and safety and social protection. And then the health impact of the lack of appropriate mechanism to provide social protection and health and well-being of those who rely on the informal economy to survive. So, after this short introduction, let's proceed to the presentation of the 4 speakers. So you did it, but they can introduce themselves when they take the floor. And I will introduce Christy Braham, Workers' Health Coordinator at WeGo, who will be introducing in a short video presentation on the impact of lack of OSH and social protection on the health and well-being of workers in the informal economy. Please.
Constanza, can we have the lights switched off? Do you have access to the IT people?
We'll try to get that done.
Get it back.
Yeah. Yes, okay. Absolutely. Let us work on that. No, there's no.
If we can switch to the second speaker.
Oh dear, we're all in darkness.
To Mrs. Oriel Sola, the head of WHO, PAHO's Health Promotion and Social Determinants of Health Unit, who will be presenting the result of a systematic review of evidence on the impact of informal employment on health. Mrs. Sola will be joining us virtually. So please, you have the floor.
Okay, Thank you very much. I'm a pleasure to stay here. I'm happy, and maybe we have to speak in Spanish, and then we have to use the translation for the other people in the session. Ok, bueno, muchas gracias por la invitación. Y vamos a presentar, ¿cierto?, brevemente algunos los resultados, parte de ellos, de una revisión sistemática que realizamos, ¿cierto?, acá en Pajo, ¿no? La que sigue, ustedes están pasando al... Do you move the slide, no? Ok, the next, please. Ok, bueno, esta revisión sistemática se enmarca dentro de una iniciativa especial sobre la acción en determinantes sociales de la salud para promover la equidad, que tiene como la parte de la cooperación suiza y en conjunto con la OMS, el conjunto de países que algo ya comentó Sujip, ¿no? En esta línea, ¿cierto? En la región de Pajo, en la región de las Américas, el foco de la iniciativa especial está en abordar aquellos ámbitos de orden estructural. Y por lo tanto, cuando analizamos la desigualdad en salud en la región, un elemento central que marca las desigualdades tiene que ver con la estructura de los mercados laborales y el impacto que esto tiene en la salud. Y por lo tanto, los ejes que consideramos fue trabajo informal, desempleo, en un proceso que está, ¿cierto?, post-pandemia, los procesos migratorios, que tienen mucha relación con la inserción en la informalidad en los países en términos receptores, los temas de cohesión social o soporte social, que marca también muchos de los temas y las características de la región en términos de violencia y relaciones y cooperación, y los asentamientos informales, ¿no? Que se mezcla, porque nos encontramos con población migrante, informal, viviendo en asentamientos informales o en condiciones, digamos, de vivienda que son clave con respecto a algunos procesos. En ese contexto, ¿cierto? Esta revisión sistemática que se enmarca lo que voy a contar sobre específicamente el foco en trabajadores informales, hay una serie de iniciativas que son parte de las acciones comprometidas en la iniciativa especial, que son reuniones regionales que esperamos tener este año para cada uno de estos tópicos, etcétera, ¿no? La que sigue. Bueno, las preguntas que se hizo esta revisión sistemática fueron en dos ámbitos, ¿no? Uno, ¿cuál es la relación del trabajo informal en la salud para la revisión sistemática del trabajador informal? ¿Y qué intervención y política habían reducido el impacto negativo en la salud o qué información había tanto a nivel individual como en términos de barreras sociales vinculadas a la implementación de estas políticas e intervenciones? Yo me voy a concentrar principalmente en la primera pregunta y voy a tocar algunos aspectos de la segunda. ¿La que sigue? Bueno, la que sigue. Bueno, acá un poco son para tener una idea de lo que se hizo en la revisión sistemática, en las fuentes de datos. También complementamos información con literatura gris. Nosotros queríamos sobre todo ver lo que pasaba en la región. En la región a veces, muchas veces la información o reportes o estudios sobre esta materia no necesariamente están publicados en revistas indexadas, entonces lo complementamos. Y un poco la búsqueda en términos de la información indexada, ¿cierto? Era identificamos cerca de 1000 artículos, de eso, ¿cierto? Hubo una duplicación, revisión y nos quedamos finalmente, aquellos más robustos, con 131 artículos, que es lo que yo voy a contar. ¿La que sigue? Acá está un poco las principales categorías que se tomaron de análisis y se sistematizaron. Por un lado, en un lado ustedes ven, por un lado, las enfermedades diagnosticadas, que se describían en los artículos, en 48 de ellos. El tema de las enfermedades crónicas, ¿cierto? Como un tema del límite en lo que es laboral y no laboral, que cada vez vemos este límite difuso en muchas de las áreas, ¿cierto? De la enfermedad cardiovascular y otras. 34 estudios, estudios que más bien había orientado a la salud autopercibida como un proxy muy importante del estado de salud de la población, condiciones laborales y factores de riesgo en los lugares de trabajo, 17 estudios y otros hallazgos negativos, en total 10 estudios. Y acá hay un listado un poco de las patologías o los problemas de salud o los diagnósticos referidos, ¿no? Desde silicosis, desde problemas de enfermedades respiratorias, tema de cáncer, las intoxicaciones agudas por metales pesados, las enfermedades crónicas estudiadas en términos de comparación con población general, ¿cierto? El tema de salud mental como un tema muy relevante, la autopercepción negativa, ¿cierto? Con respecto a la salud y ciertas condiciones, ¿cierto? De riesgo en términos de accidentes, ¿cierto? Tanto laborales como vinculados a cierta exposición a químicos y otros hallazgos negativos considerados en términos de la mortalidad asociada con peores condiciones de trabajo. ¿La que sigue? Entonces voy a mostrar algunos ejemplos, ¿cierto?, de esta revisión en este periodo de tiempo que es la diferencial exposición que tienen los trabajadores informales en relación a los riesgos ocupacionales, ¿no? Y sin duda, ¿cierto? La inserción del mundo de la informalidad en aquellas actividades económicas predominantes definen un perfil de lo que son los riesgos y las condiciones de trabajo. Y por otro lado, esto se asocia a los patrones de salud y enfermedad, ¿no? Eh, ¿Se salió la presentación? No sé. So sorry, I don't know that what happened because I see it's more small.
¿Sí? A ver, no.
I don't know. I see the small. Now it's not in the, I don't know what happened. Well, okay. Next, 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 next. Okay, here. Okay, and no, before that. Okay.
Perdón.
Ok, entonces estas condiciones de trabajo definen el perfil de enfermedades y accidentes, ¿no? Y en ese sentido acá hay un ejemplo que tiene que ver con respecto a la exposición, ¿cierto? El trabajo de reciclado de batería, la exposición a plomo, que se da, ¿cierto? Tanto en el sector formal, pero principalmente informal. Y los estudios muestran, ¿cierto?, cómo estos niveles de exposición, ¿cierto?, a plomo en sangre son mucho mayores en las situaciones de condiciones de trabajadores insertos en en la economía informal que aquellos que trabajan en la economía formal. Entonces, teniendo similares perfil productivo, las condiciones de trabajo, ¿cierto?, insertas en el trabajo informal siempre se caracterizan por ser más precarios y por carecer, ¿cierto?, de una u otra manera de las condiciones adecuadas de seguridad estándar, la falta de equipo de protección personal, menor conocimiento de los riesgos, falta de acceso, ¿cierto?, a chequeo, control, ¿cierto?, o seguimiento en materia de vigilancia en el área de salud laboral. Y por lo tanto eso se traduce en un impacto importante en el cual en muchos de estos trabajos, que además se insertan a veces a pequeñas empresas, ¿cierto?, o empresas familiares, se asocia también, ¿cierto?, la contaminación propia de los lugares de trabajo al entorno, digamos, familiar, ¿cierto? Y por lo tanto niños y familias vinculados a ello. ¿La que sigue? The next. Ok. Por otro lado, ¿cierto? También se ha visto en algunos de los estudios, aquí traemos un tema de Brasil, estudiado los trabajadores informales a tiempo parcial, en el cual se veía que los estudios que hicieron con respecto a cáncer había un riesgo mayor, de un odds ratio de 3,4 en relación a los trabajadores formales, ¿no? Y esto vuelve a ser un poco vinculado a los riesgos propios que se exponen los trabajadores informales, los rubros que predominan, pero también nuevamente que las características y las condiciones en que se inserta en materia de protección y seguridad son mucho más precarias y mucho más limitadas y por lo tanto se ve reflejado eso en los resultados en salud. ¿La que sigue? Next. Por otro lado, ¿cierto? Un tema muy relevante ha sido el impacto de la informalidad en los temas de salud mental, ¿no? Y en los estudios, digamos, y en la revisión realizada destaca, ¿cierto?, la mayor prevalencia y la importancia en términos de riesgo de la depresión comparada con los trabajadores formales, teniendo un odds ratio de 5,02, ¿no? Y ahí hay temas relevantes que se destacan en los distintos estudios con respecto al estrés crónico, la ansiedad, el aislamiento social dada la inseguridad económica, la falta de reconocimiento, ¿cierto? Y la falta de redes de soporte, y que se acrecenta, por ejemplo, para los trabajadores y trabajadoras que se insertan además en condición de migración o no formales, ¿no? Que ha sido más crítico en la región en los últimos años, ¿no? Y esto se da principalmente también, ¿cierto?, cuando vemos asociado que para muchos de los trabajadores informales en los países de bajo o menor ingreso encontramos mayor extensión de jornadas laborales, ¿cierto? Y por lo tanto eso también se traduce en el impacto de salud mental. Next. Por otro lado, ¿cierto? También destacamos las barreras de acceso a la salud y los servicios de protección social, ¿cierto? Los trabajadores informales casi un 30% de ellos reportan, ¿cierto?, una peor resultado en salud, percepción de salud en relación a lo que son los trabajadores formales, ¿no? Y esas condiciones precarias en términos de extensión de jornada, de inseguridad económica, de falta de beneficio, se traduce, ¿cierto?, de una u otra manera en las limitaciones de acceso en términos de mayor gasto de bolsillo con respecto a lo que significa acceso a la salud, a los medicamentos y tratamientos. Y por otro lado, para las mujeres, que corresponden en muchos de los países de la región, una proporción mayor del sector de mujeres inserto en el trabajo informal, nos encontramos, ¿cierto?, que la doble carga vinculada, ¿cierto?, al trabajo informal, entra y sale del trabajo informal vinculado a la carga doméstica, se traduce también en una limitación con respecto a acceso a servicios o priorización, digamos, de sus necesidades. Next. Y acá yo quiero mostrar algo que se hizo en la región, y no solo en la región, en 12 países de la región de las Américas, en 6 países de la región del África y 6 de Asia, fue analizar el acceso a los servicios de salud de los trabajadores informales. Y cuando analizamos esto, que me parece a mí muy central, es que cuando uno mira, ¿cierto?, el mundo de los trabajadores informales y a la vinculación con los servicios, el acceso a la salud, un elemento central es cómo se percibe la necesidad en salud, ¿no? Y cómo la necesidad en salud se expresa en demanda, ¿cierto?, de servicio y búsqueda de servicio y atención. ¿La que sigue? Y en ese sentido, habitualmente cuando miramos las barreras de acceso a la salud, pensamos en la organización de los servicios de salud, ¿no? Las barreras vinculadas a la oferta, ¿no? Pero nosotros en estos estudios que hicimos, que fueron estudios cualitativos en distintas realidades, ¿cierto? Con distintos tipos de inserción de informalidad y encuestas que hicimos en algunas de las ciudades grandes, nos encontramos que bien emergen las barreras asociadas a las condiciones de empleo, que llamamos las barreras asociadas a la demanda. Porque lo que vimos que los trabajadores vinculados al sector informal, su concepto de salud y su priorización tiene que ver con el trabajo, con los ingresos diarios. Y por lo tanto, solo se vinculan con los servicios de salud o con los temas de asistenciales si es que hay una situación que le impide trabajar. Eso implica que la prioridad para los servicios preventivos o la prioridad para programas que no resuelven un tema inmediato no son priorizados por los trabajadores informales. Y eso fue muy claro cuando vimos en el contexto de la pandemia las medidas, digamos, de salud pública o no farmacológica con respecto a quedarse en casa o otras medidas que les implicaba pérdida del ingreso frente a carencia y seguridad social. ¿La que sigue? Entonces, nosotros vemos, ¿cierto?, que los tiempos no disponibles, ¿cierto?, la pérdida de ingresos, la inestabilidad en el empleo, la falta de protección social y la limitación también de organización en términos de la informalidad en un grupo que si bien existe en instancia organización de algunos de ellos, la estabilidad con respecto a esa informalidad también se da una rotación importante, son en el fondo esta frase de no tener derecho a estar enfermo, ¿no? La que sigue, next. Bueno, habitualmente miramos esto, ¿no? Las barreras asociadas a la organización de servicios. Y nosotros miramos que acá hay barreras importantes asociadas a las condiciones de empleo. La que sigue. Y acá, ¿cierto? Un poco, la que sigue. Next. Ok. Y acá entonces miramos, next. Vemos, digamos, cómo desde lo que son los trabajadores asalariados o el empleo informal y aquellos que también miramos de cuenta propia, ¿no? En que también en los cuenta propia, en la restricción de lo que hemos tenido del aparato estatal, vemos trabajadores, condición de honorario o autoempleados, ¿cierto? En una condición de falta de ciertos derechos sociales y laborales a instancias tan formales como el Estado, ¿no? Y nosotros vemos entonces la pérdida del ingreso, la pérdida, digamos, la preocupación de los cambios con respecto a esas condiciones de empleo. La que sigue, next. La inestabilidad en el trabajo, next. La dificultad en conformar organizaciones de trabajadores, next. Y la falta de protección social y derechos laborales. Y un poco lo que queremos enfatizar acá es que el acceso a los servicios, sean sociales, sean servicios de salud, solo son posibles en la medida de aquellas barreras vinculadas a las condiciones sociales en las cuales se insertan los trabajadores informales, que son esas condiciones de empleo. Si esas condiciones de empleo no son mejoradas, el acceso a los servicios de salud y otros servicios sociales son limitados porque el empleo por sí mismo, ¿cierto? Se constituye, las condiciones de empleo, estas condiciones de empleo precario, se constituyen en barreras de acceso, ¿no? Con respecto a la concepción y a la búsqueda y a la expresión de la demanda de los trabajadores y trabajadoras informales. La que sí, next. Bueno, y en términos de grandes resúmenes, acá hicimos un breve síntesis de lo que había en materia de recomendaciones. Por un lado, la importancia del trabajo intersectorial, ¿cierto? Que ya se ha señalado, la importancia de salud, de trabajo, de protección social, de vivienda. Y acá un tema importante sobre la gobernanza multisectorial. Hubo importante aprendizaje sobre el trabajo intersectorial, multisectorial en el contexto pandemia, ¿no? Y se generaron espacios en respuesta a la crisis muy relevantes. Nosotros hicimos seguimiento de varios estudios de caso en relación a ello, pero sin embargo, la sostenibilidad de ese trabajo intersectorial y multisectorial, una vez pasada la situación de crisis y pandemia, no tuvo la continuidad esperada, ¿no? Cómo la situación de crisis favorece, ¿cierto?, una situación de trabajo intersectorial, pero al mismo tiempo, cuáles son los elementos que no nos está dando sostenibilidad a ese trabajo conjunto entre sectores, incluso entre agencias, ¿no? Por otro lado, integrar salud y empleo en los programas y por lo tanto hay un papel de la atención primaria salud en el cual juega un papel importante en el primer vínculo y acceso que tiene el conjunto de la población o residente en los territorios para lo que es la población informal. Tercero, la expansión de protección social que ustedes ya han señalado, ¿cierto? Y se ha enfatizado. Y también, ¿cierto?, la línea de progresiva formalización. Pero, sin embargo, en nuestra región, ¿cierto?, hay países que tienen 80% de trabajadores informales, los que tienen menos son de 30, 40%, ¿cierto?, de algunos países en la región. Y esto lleva décadas, ¿no? Y de una u otra manera nosotros vemos que el trabajo informal, las condiciones, es parte es parte del modelo estructural del mercado de trabajo. No es algo transitorio, ¿no? En cómo lo vemos, en cómo se insertan y cómo opera. ¿La que sigue? Next. Algunos ejemplos que quise destacar, uno de Brasil, ¿cierto? Como el programa de salud a los trabajadores de programas informales que combinó con atención primaria y con programas, digamos, de soporte, de entrenamiento, implicó una disminución de ciertas enfermedades laborales y la percepción de bienestar de parte de la población en situación más vulnerable. La importancia de lo que fue, ¿cierto?, la cobertura universal en Tailandia para el tema de los trabajadores informales y el acceso a ciertos servicios vinculados a ello. Y por otro lado, en Costa Rica, ¿cierto?, cómo se ha buscado el trabajo desde los servicios de salud vinculados con partners, ¿cierto?, comunitarios y por lo tanto de esa manera establecer una expansión de lo que es el acceso y cobertura para aquellos trabajadores que se insertan en la economía informal. Next. Bueno, esta es la última, ¿cierto? Y un poco de conclusión. Bueno, nosotros vemos que es esencial implementar acciones intersectoriales o multisectoriales para efectivamente abordar no solo las consecuencias del trabajo informal, ¿cierto? En términos de la informalidad del empleo, en la salud, sino sobre todo ir a las causas subyacentes que asocian al trabajo informal, que requiere, ¿cierto?, del trabajo con empleo y seguridad social, que emplee procesos de regulación y control, ¿cierto?, en esta materia, porque mientras no abordemos esas condiciones, digamos, de empleo precaria o informales, van a seguir siendo barreras con respecto al acceso, no solo en el tema financiero y no solo en el tema de protección social, sino también en cómo se conceptualiza la salud y se expresa esa necesidad en salud de parte de los trabajadores y trabajadoras informales. Muchas gracias.
Thank you very much, Mrs. Solar, for this very important and interesting presentation. I know also that it's middle of the night, probably for you, so thanks a lot for being with us, and good night after. Let me introduce the second speaker, and we will keep the video for the end of the session. So Dr. Juka Takala, from the Tampere University, Executive Director Emeritus, past President and Board Member of International Commission of Occupational Health. Dr. Takala will introduce the joint ILO-WHO work on estimates on global fatal and non-fatal injuries and deaths by work-related disease and occupational risk factors attributable to deaths. Please, you have the floor.
Thank you very much, Mr. Chairman, and thank you for inviting me to be here today. I am here, have the slides, please. I'm talking here on behalf of the Tampere University, but I have a bit broader background myself. I used to work for the ILO for 26 years in 3 continents and 6 countries, 6 languages. So I think I have a bit of a broader perspective from Africa, from Asia, and some of Latin America as well. I think this is something what is really important, that we are looking not just the sort of health expenditure and protection itself, but also a key point, how to prevent that kind of problems what we have. So maybe here on the screen we have something what you can see, the leaf pickers in Africa, but also some of our migrant workers in our industrialized countries, they have a big trouble compared to the rest of the population. But if you look at the global picture, clearly the informal sector in developing world, developing economies is the major problem. So come to my next slide over here. I'm talking about the informal work, practically no coverage of any protection no protective measures. And the universal healthcare should be also universal occupational healthcare, what is missing still today. And then one important thing that we, for example, when I was in the ILO, we made a study in different countries, some of them in Latin America and some of them in Asia and in Africa. And the African workers, they said that they don't have any distinction whatsoever whether they work morning or evening or even night. That time, wake-up time is all working time to find livelihood, find food for themselves, for the kids, for shelter and so on. So I think that's another thing, that it was difficult to compare the sort of informal worker to the rest of formal workers who have 8 hours working days and things like that. Then also one important thing that what we can have is to have not just the all formal benefits what we have in our workplaces here in Switzerland and elsewhere, but looking at the basic services, what we are advocating, basic occupational safety and health services. They may not be able to ratify the ILO's Convention 161 today, but they can start from some action already today. So if I look at the next slide, we have about 2.9 million fatal cases caused by work every year. And I made a quick calculation. We don't have real statistics. Informal sector doesn't have, they don't produce any reports, no statistics, nothing whatsoever. But the estimates are that based on World Bank data, how many informal sector workers we have, 2 million workers are in the informal economy. And that means also that out of the 3 million fatal cases, maybe more than 2 million are taking place in the informal sector. Looking at the exact data on the informal sector size, I talked with the big conference delegates of India. They said that the coverage of any protective measures, whether it's safety and health laws or compensation bodies or things like that, is 6% of the workforce. 94% are informal workers. In Pakistan, the director of the institute in Lahore told that 2% of the legal coverage is covering 2% of the population is covered. So these are the things where we really have the basic, big, huge amount of informal workers. Of course, we have informal workers in Europe and Latin America and North America and Japan. But I think the bulk of the labor, the informal sector is over there. Also, we have to keep in mind that this is a big, big expenditure in the world, in the whole world of work. And we calculated close to 6% of the annual GDP is lost. And this is only the lost caused by production losses, because they are, if people come sick and die at work, they don't produce anything. If they are disabled, somebody else will have to provide food and shelter for those people. And if you cover all the others, so hospital expenses and suffering of the families and so on, then we come, according to my own background in Finland, we have 9% made by the Ministry of Social Affairs and Health, expect 9% of the loss of the GDP every year. So this is what we can make really financial benefits, and we can make gains if we can take better care of our health of all workers, including the informal sector workers. Next slide, please. Next slide, please. So this is the basic calculation we had different between 2017 and 2023, the 2.9, and it's a plus over there. And the plus is that most of the data is based on 2019. If we take the COVID years, suddenly we have much, much more. Okay, the COVID doesn't last forever, but equally, the ILO has just decided to take care of not only the communicable diseases in general, but looking at all biological hazards at work. And I've been lucky and happy to contribute to that, making the basic draft for the reports of the ILO, and one discussion already held, but hopefully we have next year something on that. But biological hazards are exactly those that are big business in the informal economy. Think about agriculture globally. There's a lot of problems what is in the biological parts, including viruses, bacteria, and animals, and diseases caused by the work itself. The reports behind, I'm referring to 3 papers here. What is the International Journal of Labor Research published during COVID time, the red on the right-hand corner down. But then the second one is the brand new paper that's published this year by the Scandinavian Journal of Work Environment and Health. What is largely also the baseline for ILO's present estimates for global problems. And that is, as I said, not only 2.9 million, but maybe several hundred thousands more because of the biological hazards. If you look at the big problems equally for the informal sectors, they are the same, but not in this shape what we have here. This is from the whole world. We expect cancers is a big problem, cardiovascular, but then respiratory and particularly communicable diseases is a major problem in the informal sector, and come to some of that later on. Next, please. So the data what we had before was at 2 billion, 2 milliard in some of the other languages are employed in the informal economy. And that means 2/3 of the fatal cases are close to 2 million. Women are overrepresented in unregulated work, and they also earn less in the informal sector, exactly as in the formal sector. Next slide, please. What are the indicators? So usually we calculate what is the percentage of the active labor force covered, whether it's compensation coverage or enforcement coverage or protective legal coverage. So if we have that percentage, as I said, 94% of Indian population is not covered. And that's exactly the case what we had. 2/3 of the workforce of the global things is not covered. And particularly one of the things is what are the ratification level of different countries, particularly the fundamental conventions 155 and 187, and also 161. And of course, informal sector by definition is not covered in any case, whether they are covered by the government or not. Next, please. So occupational diseases are common. Common diseases are occupational. Any of the disease what we have may come at work. So for example, COVID is common thing that, yes, it's a common disease, but much of it is taking place and distributed by workforce. So for example, we know that the nurses who are taking care of the doctors and so on in hospitals, but equally, for example, construction cleaners, they are usually the ladies who come together when buildings are almost finished. They take all the rubbish and try to clean the building. They have 3 times higher level, they had 3 times higher level of COVID, exactly like the nurses in hospitals. Because of, at that time, all others, plumbers and electricians and painters, they are all in the same team, and they share the COVID viruses even in the workplace. So these are exactly the case. Clearly also taxi drivers and so on, other people who are dealing with customers, they are equally victims. But that's the same case that common diseases are very often occupational. One more thing, that the workforce is important in distributing to the non-working workforce. Those people in the old age homes, they are not going to discos or singing or mass gatherings. They are staying at the old age home. The workers are bringing the COVID and whatever other problems inside there, and then they die. The old age people, they end up dying. So I think this is some important thing, that workforce is a key point in prevention too, to find out ways on that. Next, please. Should we take care of the two sustainable development goals, good health and well-being, advocated by WHO, and decent work and economic growth advocated by ILO? No. Next slide. Work and workforce is linked to all UN Sustainable Development Goals. So if we want to eliminate poverty, if we want to eliminate the informal sector or reduce the informal sector, we need resources. Who is making the resources? Workforce. Well, this is, workforce may be a victim sometimes, but it's also the solution if we can use the workforce in a correct way. So the same thing for zero hunger. Where are the resources coming? Quality of education and so on. All of them are linked to workforce and work. Next, please. So looking at some of the differences, we don't have the data for informal sector because of the reasons I mentioned, but we can compare, for example, the EU 27 to global. Global covers all countries. Clearly, the big troubles what we have in established market economies, cancer and cardiovascular, they become much smaller in the informal sector because they are changing the global picture. But there again, have much higher level of the communicable diseases, the yellow and the black one over here, and the injury component. So that's important thing to keep in mind. Next. And this is not only the fatal cases, but even more clearly visible for the disabilities. And the global picture is almost half of them are exactly those injury component, but the other diseases which are communicable respiratory diseases and so on. So that's again the informal sectors are victim for that. Next, please. Couple of more slides on cancer is a disease, and cancer you can replace the word by COVID or whatever, lung disease or so. Occupational cancer is an administrative decision, and once that is not, there's no coverage. So we should rather follow the ILO's definition of occupational diseases. Next. And where are the problems? The right-hand side, two high pillars, these are absolute figures, are from Asia. Southeast Asia and China are the last pillars over there. So it's also there we have the highest number of informal sector workers. And then in Africa, second from left also. But the difference of different diseases is also very much different, both for the formal sector and for the informal sector. Next, please. And if you look at the deaths from the global burden of disease, you look at the minimal health system, you see the red is communicable diseases, the blue is non-communicable diseases. So if you look at the red, orange, this is for the minimal health system, the countries that are having most informal sector workers, compared to on the lower scale, high socioeconomic development index is quite different. So heart diseases, stroke, lung cancer, and so on are much more prevalent in high economies than the minimal health system. So that's exactly the case for informal sector. Next, please. And next, please. Disability is exactly the same thing. We don't go into future. Next, please. Health, occupational health services, maximum 15% of the world is covered, probably less even than that. We made a study for last number of countries, and these are the results. Next, please. But we can start with the scratch stage one of having some support for the informal sector, like basic occupational health services. Next one. So key recommendations. Have an ILO WHO joint committee to discuss this kind of thing. ILO-WHO Joint Committee was last time established by myself, representing ILO when I was working here. And from WHO, we had Margaret Chan, Environmental Health Department. At that time, she became Director General of WHO later. Since that, we haven't had any discussion on ILO-WHO Joint Committee at all, and less action as a result. So these are the key points what I had wanted to say. Thank you very much. Next slide.
Thank you very much, Mr. Tagala. Before joining this position, I was a director in West Africa, and you are a legend there. So I'm very pleased to have this opportunity to meet you finally.
Well, legend, past legend.
So let me move to my colleague, Christina Behrendt, head of the social policy unit in the ILO, who will present on social protection coverage gaps in the informal economy and practical experience on extended coverage. Please, Christina.
Yeah, thank you very much, Frederic. And I know that we're all running late. So I'm trying to be as concise as possible. So apologies if I'm rushing a bit through the presentation. If you can then have the next slide, please. So we all know that social protection is a universal human right. And I think what is important here is that, I mean, already in the Universal Declaration of Human Rights, where the right to social security is related, there is a very, very clear link to adequate health and well-being. And I think this is a key point. And I think the previous speakers have reminded us very forcefully also, especially highlighting the example and the experience of the COVID pandemic, how much this has really affected workers in the informal economy, and how much harm it has been done to those workers. But I think it has also shown, and I mean, I think if there is a small silver lining in all that, I think it is that workers in the informal economy have become more visible. And I think they have become more, have moved more to the attention of policymakers, at least in a temporary way. And I think there were a lot of temporary measures, as we have seen. Unfortunately, many of them have already been ending. But I think that should really remind us to not really stop and really keep reminding policymakers also how important it is to extend both universal health coverage, but also universal social protection. And we have heard how much they're interlocked and how much they need to work together. And I think this is a really a very much a key point. And if we can move to the next slide. And Shara has reminded us earlier that not any social protection system will do. I think there are key elements in the design of social protection systems to really make them more effective when it comes to supporting people access to social protection and access to health. And I don't want to go into the detail, but I think what is key here is really to establish rights-based social protection systems, which are anchored in human rights and international social security standards, is key really for this very comprehensive approach that can also contribute to improving the social determinants of health. And I think we've heard that very, very forcefully. So, and I think the ILO's international social security standards are essential here, looking both into income security and access to medical care. And I think I've here on the slide, you see a few references to some of the conventions. But I would also like to highlight that there is a very important recommendation on social protection floors, which again refers to income security and access to healthcare. And this is essential because it really provides the basis for a guarantee, again, based on a rights-based approach. And I think it's not by coincidence that it's referred as a social protection floor, as something which is very solid and very reliable. And I think that stands a bit in contrast to this notion of safety nets, which are quite wobbly and full of holes. So, and I think it's important really to build that social protection floors really as the fundamental elements of social protection systems. And if you can go to the next slide, just very briefly, I cannot go into the details, but just reminding us about the key stage, and was already mentioned earlier that almost half of the global population is excluded from social protection coverage at all. And many less people have access to adequate protection, which is comprehensive and really goes through all of the different elements that we've seen before, whether we talk about sickness benefits, whether we talk about maternity benefits, family and child benefits, and you can see the coverage rates there on the slides. And many of those who are uncovered, and these were the 2 billion workers that you mentioned before. And I think also, I mean, the ILO statistics on that show that very clearly, and also provide the necessary disaggregation to really show who is it exactly, what kind of what sectors, what occupations, whether this is self-employment or workers in wage employment. And I think it's important also to unpack this notion of workers in the informal economy and look in more detail of who is actually considered here. And just one, can we go to the next slide? And can you click again? I think we're missing some elements. Again, yes. And another one. I think what is really important here, and this is why we often talk about the missing middle when we speak about those in the informal economy. These are those who are not covered by the existing contributory schemes, neither are they covered by the existing programs, which are mostly geared to the poor population or those very specific categories of the population. So those in the informal economy, they're often left in between. And this is why it is so important to extend coverage to them, and both through the social insurance mechanism, because they really provide a basis for larger risk sharing, for solidarity at the national level, for very clear entitlements, and also for both vertical and horizontal redistribution, and for to provide also the basis for addressing inequalities. But also looking into the non-contributory, more the tax finance type of benefits to really ensure that there is at least the social protection floor that guarantees at least this basic level of coverage for everyone. And it is possible. And so just if we move to the next one, sorry, I'm rushing a bit through. But I think when we think about and look in more depth of what stands in the way of extending coverage, we see that there are quite a number of barriers. We have barriers that are found in the national legislation, that some categories of people are not covered, quite often the self-employed, quite often workers in agriculture, for example, quite often domestic workers, just to give some examples. But there are also a number of other barriers when it comes to whether benefit packages are aligned with people's needs, the financing mechanisms, do they work for those who have no or very limited contributory capacities. But also, I think there's also a lot of barriers on the administrative side. There are barriers when it comes to raising awareness, to trust, in trust in public institutions. There are challenges when it comes to enforcement and compliance, and also the question of the organization of workers. But there are measures that can be done and can be taken to address all of these barriers. And actually, it's not the question of doing just one of them, but really having policies in place that can address all of these challenges at the same time. And this is really key for national strategies to extend coverage to those in the informal economy. Can we go to the next slide? And I think what is very clear in building the national social protection systems, which can also cover those workers in the informal economy. And I would like to highlight here especially the intersectoral collaboration. I'm going to mention some examples at the end. Making sure that there is really one entry point for everyone, for including workers in all types of employment. That the coverage is not just for individuals, but on a family or household basis, the very important link to occupational health service and rehabilitation. And really this comprehensive coverage that covers both access to healthcare and medical costs, but also the income security. And I think what is important here is also in doing that to avoid disincentives for formalization, but coupled that with the fact of reducing vulnerability, reducing decent work deficits, really in a transformative approach that can really also facilitate the transition from the informal to the formal economy, as Ariel has mentioned earlier. And I think this is an essential part. So just very super briefly, just to conclude, if you can move to the next, another one. Just some country examples. So the first example that I want to give is really highlighting the importance of national social protection strategies, because they can really provide a forum for this intersectoral collaboration, which is necessary. And I'm just highlighting here some examples from Lao PDR, and I think Marielle, who is here, can maybe talk a bit more later on, or if you have any question, from Lebanon and Kenya, where these national social protection strategies have really been key in supporting very concrete measures to extend protection to those who were not yet covered before. And finally, another example, but which is also another example of intersectoral collaboration, if we can go to the final slide. And this is, I mentioned before, workers in agriculture, and finding ways to extend protection to them in a way that really responds to their situation. And I want to just highlight two examples of collaboration with ministries of agriculture, but obviously also ministries of health and labor and social protection, to link the social protection coverage and access to healthcare to mechanisms which can also support these formalization efforts. So one is an example from Ivory Coast, and I think, Frédéric, you're very familiar with that. The linkage to the registration of agricultural workers and their families, just to facilitate access in that area, looking specifically, for example, at the cocoa value chain. Another example is from Costa Rica, where there's a long-standing practice to have cooperatives of agricultural workers facilitating access to the national health insurance schemes. And I just want to end with that, to really highlight that this extension is possible, it's feasible, it's necessary. And I think we need very much these adapted solutions, but not fragmented solutions. And so I think building systems and really working across sectors is very important in that respect. So thanks, and sorry for rushing through a bit.
Thank you very much, Christina. Sorry to rush you. We still have a 5 minutes video to watch, or it will be later on. So if we don't want a coffee break to be a brunch break, we will have a short Q&A session. We have very knowledgeable speakers here, so it will be a missed opportunity not to open one round of questions and answer And I will ask after the speakers to conclude after their response. So,
questions online?
No question online. That's a good news in some way. No, but 1, 2 questions or not. No, so we will conclude this session. Thank you to all the speakers online or here. Thank you to all the audience. I think we have seen how the interplay really between informal employment, health, well-being, social protection. We see also how the lack of social protection, but also the issue of occupational health and safety is a consequence of the informal economy. Because of legal and implementation gaps for those in the informal economy, but also it is a core component of any solution. And you need social protection to improve living and working conditions. You need also social protection and occupational health and safety and good working conditions to improve productivity and to push for structural transformation. So I think we will have the opportunity during this day to go further on all those issues. And I would like to thank you and wish you a good coffee break.
Thank you. Thank you very much to the speakers and to